Right now I'm 81 years of age, 81. I'm a retired surgeon. Uh, my problem started when I was 57 years of age. I was on my way home from Denver. I went to Denver for a medical meeting, and then at San Francisco, we landed in San Francisco, I had to go to the bathroom. And I noticed that my urine was wine colored, sort of reddish brown. And I knew in my mind at that point that was blood. Wine-colored urine is blood until proven otherwise. And when you have blood in your urine, what I learned in medical school was that it's a tumor until proven otherwise. Tumor, not stones. In 1987, I had urine in my blood and went to my urologist, and he was able to find at that point I had a big mass in my right side of the abdomen.
Can I correct you already?
Huh?
Can I correct you already? Okay,
She's the boss.
I told him to write a lot of notes. In January or February, this is when he discovered the blood in his urine when he was coming home. But he went to his internist and explained the story, and he had been on a drug that is very common, allopurinol, to prevent gout. And he thought maybe it was the allopurinol. So he really wasn't operated on until July. So all that time, you know. Okay, go ahead.
Well, anyway, I went to my urologist, and they were able to feel my abdomen, and I was found to have a large mass in the right side of my abdomen, right kidney.
That's right.
In July of 1987, now I was 57 years of age at that point. I had, being a physician, I had the best in town, okay? I had a urologist operate on me, and also a thoracic cardiac surgeon, and a renal transplant surgeon. All three surgeons operating on me. Mark Grief scrubbed in on my case. He was chief resident at that point. And the last person was a medical student who is now the chief of surgery, chairman of surgery at the University of Hawaii School of Medicine.
Wow.
So I had basically the best in town.
Yes.
The best in town. So they opened me up from stem to stern, just like the way you people had. From up here, from the top of the bottom, near the neck here, all the way down to the pubic bone, open up completely. Okay, and they were able to take the right kidney out, but when they were doing this, they noticed a cancer clot that came out of the kidney. The cancer clot was going into the blood vessel all the way up to the heart. In other words, this is not the tumor extended in the blood vessel that drained the kidney all the way up into the heart. So what they had to do was to pull this cancer clot out. They were able to do that. It wasn't stuck. It was waving in my heart, waving around. At that point, as I say, my chest X-ray was negative. Everything was negative, so the tumor was only in the kidney, growing up in the blood vessel into the heart. They were able to pull everything out. At that point, I said I had no disease elsewhere. So I did well with that operation. And then I went back to work, right? I went back to work, did surgery. 14 months later, follow-up chest X-ray showed multiple spots in my lungs. Multiple spots. And of course, when you have renal cell carcinoma, the first thing you think of is spread to the lungs, which is true. Okay? I was very disappointed. I mean, when you get a report like this and get a chest X-ray, I mean, you know, you get scared like hell.
Oh, yes.
So at that point, there was no real treatment for renal cell carcinoma spread. Chemotherapy at that point was like holy water. So my oncologist recommended that I go to the mainland, to one of the big cancer centers, MD Anderson Hospital in Houston, where I would be a guinea pig, and they would try therapy, not with chemotherapy, but by what they call immunotherapy. Immunotherapy. Because some people say that when you get kidney cancer, it's due to the fact that your immune response is depressed. So when you get immunotherapy, that sort of the medication sort of builds up your resistance. So I went up there as a guinea pig. I said, well, I want to try. I'm going to try. So I went up, I was referred up there to MD Anderson, where they gave me 2 immunotherapy drugs as an experiment. I was an experimental animal, basically. Interleukin and interferon. At that point, the doctors there didn't know how much to give, because the medication was it was an experimental drug. They did not know how much to give, and what they did was they slowly increased the dose until I got sick. Toxicity, they call it, toxicity. That's the end point, when you get sick. Well, I got sick like hell. My temperature at that point was 105. My blood pressure was 50 over 40. I had watery diarrhea. I mean, I couldn't go to the bathroom. I mean, my wife was following me, cleaning up the floor. I couldn't reach the toilet. My body filled up with fluid. I was like a balloon. And that's what they determine as the end point. In other words, they bring you up to that level, and when you reach toxicity, that's it. In other words, you get sick like hell.
Was that interferon,
Well,
interferon alpha?
Alpha interferon, yeah.
Oh, yeah.
Alpha interferon and interleukin 2. Interleukin 2. This was all experimental at that time, you see. Follow-up X-ray showed that I did respond partially to
After
this.
how many treatments, though?
Yeah. Okay? Well, because I did respond, I made a total of 3 trips up to Houston, Texas for treatment. Every time, 3 weeks. Back and forth, because that's the only place that had this kind of treatment, you see. 3 trips I made to Houston. My wife took me up there, and I did respond, and because I did respond, they said, well, we're going to continue the therapy here at Queens in Honolulu, okay?
Because
So-
each time we went to Houston, we stayed there for 3 weeks.
Yeah, yeah.
And then,
That's a lot of money.
So that's-
yeah.
Back and forth, you see. So they said, well, we're going to treat you here at Queens. I said, fine, you know. But at Queens, they didn't know how to handle this kind of problem. You know, when you get sick like this. I mean, immunotherapy being a brand new drug. So what they did was, at the special oncology floor, they taught the entire nursing staff how to treat me, how to handle my problem, you know, because all the complications, the low blood pressure and the diarrhea and the fever and whatnot. So they taught, being on the staff there, I mean, I sort of was very fortunate they gave me the VIP treatment. So they treated me for two more treatments, okay? 3 in MD Anderson, 2 more here in Honolulu. And what happened was that I did respond. The spots in my lungs, some disappeared, some stabilized, and nothing showed any progression. None of the spots showed any progression. So what happened was, after that, I got notes here because I have so many illnesses. They decided, my cardiac and thoracic surgeon decided to go after these spots, after everything stabilized. You see, he said, well, everything stabilized now, some disappeared. What we want to do is to go after the big ones now and take it out surgically. So I had, now it's going on to 1989, about 2 or 3 years later, I had, they went into my left chest and took out a wedge, like a piece of pie, the biggest spots. And then after that, a month later, they went to the right chest, took some more spots out of there. That's 2 chest operations. I had a total of 12 operations altogether. And I responded well to all of these. But the worst thing about a thoracotomy, they call it, when you go into the chest, is that it really hurts after surgery because when you the thoracotomy incision is healing, you gotta breathe, you gotta cough, you gotta laugh, and when you do that, it hurts like hell. But subsequently, I found out that on one of my trips elsewhere, that when they opened up my chest, they fractured 2 ribs.
Oh,
The surgeon said, "That's okay, but it hurt like hell, though. You know, when you have a fractured rib." You take a deep breath, it hurts. You cough, it hurts. You laugh, it hurts. You stress out, you know, and try to have a BM, it hurts.
Oh, yeah.
So anyway,
But we didn't even find that out because after that operation, I'm Catholic and I wanted to go to this pilgrimage in France. And, you know, he was carrying suitcases and the old-fashioned elevators with, you know, what do you call them, grating. And it was when we came back that you realized that the ribs were fractured, not before we left.
well, the next thing that happened, okay, after my 2 chest operations was that I was shopping in Kahala Mall with my wife, and she noted that I was dragging my left leg. Dragging my left leg which is not normal. So I went to my neurosurgeon and he did some workup, and he noticed that I had a huge mass in my right brain. See, in anatomy, you have the left side and the right side. The left side controls the opposite side, okay? I mean, left side controls the right leg,
No, I put it down.
the right side controls the left leg.
I wrote it.
So I had I was dragging my left leg, the tumor was on the right side, okay, opposite side.
You put
Big
down?
tumor.
Yeah. That's right.
So I was referred at that point to San Francisco. In San Francisco, I had the chairman of the neurosurgery department, University of California, San Francisco, the best, one of the best in the world, operated on me, Dr. Wilson. And he took me to surgery. The operation lasted a long time, right? About 8 hours, 10 hours. Yeah. Anyway, he was able to get the lesion was the biggest, about the size of an orange, big.
Cold.
And after the surgery, I was very fortunate. I didn't have any motor deficit. Usually, when you work on the brain, you may have paralysis, you cannot walk and whatnot. The weakness I had in my left leg was due to the swelling around the tumor on the right brain, left brain, okay? You follow? So my wife asked the neurosurgeon, he said he got everything out. The tumor, the orange, about the size of an orange, got everything out. That I did not need any x-ray treatment after surgery. He was very confident. He was chairman of neurosurgery. He was a big shot, world famous, okay? So I was fortunate in that after the operation, I had no weakness, no sensory problems. My motor function was very good.
But the reason when you say that it was a long operation was I saw
Have you got the paper?
they took him down to, you know, get ready about 5:30 in the morning.
Get one of the programs.
Wilson had told me to stay in the room and that he would call me or the nurse would call me and let me know how things were going. Well, I saw Wilson at about 12 o'clock along with a lot of other patients. So he probably opened, an intern or resident may have opened 8 heads. Wilson just goes in and does all the, you know, main stuff, and then a resident or somebody else closes them up. So I never saw him until about 8 o'clock that night, even though Wilson was finished with him at 12.
Yeah, this is what happened when you're a big professor, you know. All these younger assistants open up the head, and he goes from one operating room to the other operating room and does a major part of the surgery, you see. So I'm sure in my case, he probably had a resident open up my head, and then he would go in and do the big surgery,
Actual,
take out
yeah.
the tumor.
So when I saw him about 8 o'clock, his head was all bandaged up, eyes were swollen,
black and blue all over.
The nurse said to him, I was standing on it, she said to him, "Do you know who this is?" And he said, "The most wonderful woman in the world." And I thought, hell, you gotta be on your deathbed here, in horrible shape, and that's when I get a compliment.
Was
All
it a
right.
floating tumor or did you get majority
He
tissue?
got everything out.
You got everything
He
out.
got everything out, yeah. He said he was confident, he got everything out. It's very important, that I did not need any extra treatment.
Well, that was the
Yeah.
one question that Ed wanted me
Yeah.
to ask Wilson. Was it encapsulated?
Encapsulated is mean when you have it's covered with something. They don't have little fingers of cancer going elsewhere, you see. So he said it was encapsulated and he got the whole thing out.
Renal cell.
Renal cell.
So afterwards I didn't have any problem. My leg improved. That was due to the swelling. I was able to have no motor or sensory deficits.
He went directly from, because of his two brothers too and connections, you don't usually go to rehab from the airport. And that's where he went. And the physiatrist, the rehab doctor, told me that the average day was 6 weeks. And he was there for 1 week and home on 2 of those days on a weekend. So he really, he couldn't wait to get out of there.
All right, going down further now. After the brain operation, then, of course, I told you people that I had persistent spots in the lung. So I had underwent my third chest operation on the right side. They went after it, took out a wedge like a piece of pie, and it was metastatic, meaning spread of renal cell kidney cancer. So I responded to that well. The next operation came in 1993, when I had problems with my recurrent disease in my abdomen. I had a big operation removing the same thing, renal cell in the lower abdomen. Again, I did well with that. They got everything out. Boy, oh boy. And then I've had some other problems, okay? The last chest operation, I had 4 chest operations. The last one was done in 1994, where because I had so much scarring in the lung, they had to take out the entire lobe. So I had what they call a lobectomy. You take out the lobectomy. They took it out. And subsequent to that, I did well again. Now, the next problem with my brain occurred in 1995. 1995, okay? Of course, being the man in the house, I have to write checks to pay the bills. And my wife noticed that when I signed my checks, I was signing my name real terrible, crooked. I couldn't sign the
Because
check.
he has very good penmanship,
So what they did was they worked me up again, and they found out now that I had a spot in my left brain. Wait. Yeah. Left brain. Trouble, right hand, origin left side, opposite, it's always opposite, okay? Left side. I had trouble signing checks, and what happened